I'm joined now from Dublin by Barry Andrews, who's Chief Executive of GOAL, International Aid Agency. And Barry, I know that you've opened a new Ebola treatment centre in Sierra Leone this week. One of the reasons Justine Greening was there, and you've been there as well. What is the latest from the front line?
Well, the opening of these centres, Jeremy, is a huge step. We had our first patients in on Sunday, and we now have 10 patients, and we're determined to scale up to full capacity in our centre as quickly as good, solid, robust medical advice will allow, while also making sure that our priority to protect our staff there is absolutely balanced against that. So that's going to be part of our priority, Jeremy.
Certainly one of the sort of negative reports this week is that Sierra Leone is expecting things to certainly get worse in the short term, particularly over the Christmas period. How worrying is that?
Well, it's very worrying, and while progress has been made, we're still not in possession of enough beds in Sierra Leone to isolate the cases that need to be isolated. So there's a tremendously large amount of work that will need to be done in 2015, and of course people are talking about complacency, and we really have to work hard against that. But we've been working with NHS staff who have been absolutely heroic. They have trained to the highest possible standards. We are following all of the WHO and MSF procedures in Sierra Leone in our hospital, and we think that if we continue to scale up at this rate, we will bend the curve down and make sure that this epidemic is brought to an end at the earliest possible time.
Barry, yours is one of 2 treatment centres that are open, I believe, out of a target of 6 that are being opened by aid agencies like yours in conjunction with the British government, the NHS and so on. Once they're all open, are you will you be confident that then between all of you, you can start to turn this epidemic round, you can start to get on top of it? Because at the moment, it's still running away ahead of you, I sense.
Well, no, there are signs of progress, Jeremy, actually, in Sierra Leone. As you probably know, there have been great improvements in Liberia. But yes, these treatment centres will make a big difference, but they're one of a number of components that will ensure that will bring this epidemic to an end. Your report earlier referred to safe burials, and they are beginning to happen. But a critical element of this will be ensuring that there is community mobilisation and the messaging gets to the communities that Ebola is dangerous, that safe burial practices must be followed, that clean water and sanitation are critical to stopping the transmission of the illness. So these are all key components that must be brought together, that are mutually reinforcing. All of them must occur at the same time if we're going to get on top of the virus.
I thought one of the startling things to emerge from David Bowden's report a little bit earlier in this programme was that so many people in Sierra Leone appear to be in denial about Ebola. They simply don't believe in it, don't believe it's happening. And therefore, presumably, there is a massive education task ahead of you all as well to try to persuade people in countries like Sierra Leone how serious this is and how all of them need to help tackle it.
Absolutely. It really is an enormous effort that is required in Sierra Leone. We are running a treatment centre, but as I say, it's only one element of the way in which this virus will be stopped. The education element that you've referred to is absolutely critical. Now, what GOAL is doing, apart from the treatment centre, we're training people to make sure that they're able to treat patients with dignity. We're trying to protect orphans, those who have been left behind by the virus. We have been trying to make sure that there's as little stigma as possible associated with those who have recovered from Ebola. So there is a tremendous amount of work that needs to be done. We are getting great support from our colleagues in other NGOs. We're getting great support from the British government. But we have to remember the human stories here, Jeremy. One of our first patients was a 9-year-old girl. Both of her parents passed away due to Ebola. As far as we know, she's on her own in the world. She was very poorly when she came in on Sunday. She's beginning to show signs of recovery, and these are the stories that really motivate our staff, that bring them back all the time. But what we're going to need into 2015 are more doctors and nurses. We're going to need health administrators to have the vision to be flexible around allowing people to deploy to West Africa from developing countries. So there are major tasks ahead of us, but I do believe it can be achieved.
Barry Andrews, Chief Executive of the Dublin-based charity Gold. Thanks for that insight into the progress being made in West Africa. Thanks.